This PSA announcement is for those who are heroin addicts, those who are unaware of what heroin addiction is, and those trying to stay away from that kind of lifestyle. Boom!
Okay. Heroin is diamorphine, among other names, is an opioid, most commonly used as a recreational drug for its euphoric effects.
Heroin can be snorted, smoked, or injected into the veins.
Pure heroin is a white powder with a bitter taste, and highly pure heroin can be snorted or smoked.
Black tar heroin is sticky like roofing tar or hard like coal. Ugh.
Impure heroin is usually dissolved, diluted, and injected into veins, muscles, or under the skin. Heroin binds to and activates specific receptors in the brain opioid receptors, otherwise known as MORs. When MORs are activated in the brain, they simulate the release of a neurotransmitter, dopamine, causing the reinforcement of drug-talking behavior.
List some long-term effects. Repeated heroin use changes the physical structure and physiology of the brain, creating long-term imbalances in the
Neuronal
and the
hormonal
systems that are not easily reversed. Decision-making abilities and the ability to regulate behavior and responses to stressful situations that are slowly deteriorated by neuron use. So some short-term effects are:
Once heroin is converted into the brain, people report a feeling of pleasurable sensation known as a rush. The intensity of the rush is a function of how much drug is taken and how much rapidly the drug enters the brain and latches onto the receptors.
Some general effects are warm flushing of the skin, dry mouth, heavy feeling of extremities, nausea, vomiting, and itching. Ugh.
After these rush effects, drowsiness, mental function clouding, heart function slowing, and breathing also slows soon after. This then leads to the withdrawal stage, which occurs 24 to 48 hours after.
People may also experience muscle and bone pain, insomnia, diarrhea, vomiting, cold flashes, goosebumps, and leg pain. That doesn't sound fun now, does it?
Sharing needles to inject heroin into the body leads to a higher risk of transmitting HIV, hepatitis A and B, and as well as other infections.
We learned about that, kids. Once a person has heroin use disorder, seeking and using the drug becomes their primary purpose in life. Isn't that kind of sad?
Although, treatments for heroin include both behavioral and pharmacological medications. Both approach to help restore normalcy to the brain. Studies have shown that both methods have worked for people at the same time and is very effective.